presentation, we'll discuss a randomized phase 2 study comparing intraperitoneal chemotherapy, that is, chemotherapy delivered into a patient's abdomen, to intravenous chemotherapy for patients who underwent primary chemotherapy before surgery for ovarian cancer. Dr. Helen Mackay, the Divisional Head of Medical Oncology and Hematology at the Sunnybrook Odette Cancer Center in Toronto, will present these results. Professor Mackay.
Thank you. And I would just like to thank the organizers for giving us this opportunity to discuss the OV21 PETROC data, and I present this on behalf of my co-authors and investigators. Epithelial ovarian cancer is the 5th most common cancer affecting women. Unfortunately, we lack a population-based screening tool, and the early stages of this disease are often asymptomatic. As a result, approximately 2/3 of women will present with stage 3 or 4 cancer. Mortality rates are high. Previous published randomized trials of intraperitoneal delivery of chemotherapy have demonstrated a reduction in the risk of death for select patients undergoing upfront optimal cytoreductive surgery. Recently, we have seen an increase in the delivery of chemotherapy prior to a definitive surgical attempt, so-called neoadjuvant chemotherapy. And this is often occurring in our most advanced case patients. OV21 PETROC was a pragmatic study designed to answer the question, do these patients benefit from the delivery of intraperitoneal chemotherapy? OV21 PETROC was a 2-stage study with patients randomized at the time of surgery either to receive an intravenous arm containing standard of care drugs, carboplatin paclitaxel, with IV paclitaxel delivered on day 8, or one of 2 experimental arms containing intraperitoneal delivery of, in the case of arm 2, cisplatin, and in the case of arm 3, carboplatin. Both paclitaxel was given intravenously and by the intraperitoneal route on day 8. The reason for these 2 experimental arms is that in the randomized trial data to date, intraperitoneal cisplatin had been used, and there is one of the contributing causes to the limited uptake of IP therapy is the tolerability of intraperitoneal cisplatin. At the end of the first stage of this trial, the Independent Data Safety Monitoring Committee advised us to continue into the second phase of the study with the intraperitoneal carboplatin arm. This was based on both toxicity data, better tolerability, and also on efficacy. 100 patients were randomized to each of the intravenous arm and the intraperitoneal carboplatin arm. The primary endpoint was the progressive disease rate at 9 months. In the intravenous arm, this was 42.2%, and in the intraperitoneal carboplatin arm, this was 23.3%. This is an 18.9% reduction in progressive disease rate at 9 months. This trial was not powered to detect a difference in overall survival. That being said, the hazard ratio is similar to that we have seen in other intraperitoneal trials. And also, the median overall survival in terms of the IV therapy is similar to that seen in similar populations in neoadjuvant studies. I would remind you that this randomization takes place at the time of surgery, so those patients have had neoadjuvant chemotherapy before receiving their surgery. The overall survival, median overall survival was 59.3 months in the IP arm. Of course, tolerability and quality of life is important, and the IP carboplatin arm was well tolerated. Quality of life data did not differ between the IV and IP arms and improved with time. So in conclusion, what we have demonstrated is the tolerability and efficacy of the intraperitoneal carboplatin-containing regimen compared to intraperitoneal cisplatin. Our primary endpoint was met, and although we were not powered for overall survival, I think these data, taken in the context of other intraperitoneal studies, give information to both patients and clinicians on how to incorporate this treatment in women undergoing neoadjuvant treatment. Moving forward, we hope to better define and identify a predictive signature by looking at correlative studies associated with tissue samples collected during this study. Thank you.
Thank you, Dr. Mackay. This is yet another example of international collaboration looking at intraperitoneal treatment, but in a very novel way, because this looked at women with advanced ovarian cancer, all of whom received primary chemotherapy before surgery. And in that group of women, we have not known what the best strategy is. While this is not a phase 3 study, I think the data are very provocative and suggest there is a role for IP therapy for such patients. Congratulations, Dr. Mackay.